Uterine fibroids are a common benign tumor of the uterus that many women will develop in their 30s or 40s. While many women know what uterine fibroids are, not all of them know that there are alternatives to the traditional surgical treatments that are offered by their gynecologist. And that's where uterine fibroid embolization comes in. An embolization is a simple term for us blocking off an artery, in this case with particles. And we do this to deprive the fibroids of blood flow and cause them to shrink, in some cases die off. And this will alleviate a lot of the symptoms that the women are experiencing from the fibroids. Most of them will experience bleeding, some of them will experience pain, and then a lot of women will experience what is called bulk symptoms. So symptoms that are just caused by the fibroids being very large and moving around all the organs that are in the pelvis and lower abdomen. And these can be bloating, urinary symptoms from the fibroids pushing on the bladder, or even weight gain in some cases where the fibroids are much larger. If you are considering uterine fibroid embolization for management of your fibroid symptoms, at Summit IR, we treat this as an outpatient. So you'll come in, it'll be similar to preparing for any type of surgery, as in you won't eat any food after midnight and you'll hold any blood thinning medications. But the procedure we do will allow you to go home, 3-4 hours after you show up for your treatment. We'll place an IV, we'll give you some anesthetic medicine to drift off to sleep during the procedure, and then we'll do the embolization. We get access into your either wrist artery or the artery in your groin, and then we'll get into the uterine arteries and slowly drip these beads in over about 30 minutes to an hour. And then afterwards, you'll go back into a recovery bay, hang out for about an hour while we give you some medicine for any side effects that you might have, like nausea or some pain for the embolization. And then we'll make sure that you're walking around, you process through the anesthesia okay, and that you're able to go home.